And
Okay.
you do some manual therapy?
This is the manual therapy. We call it the perineural injection technique, and it's
That's
a
one of
manual
the
therapy.
5 that you do?
Yeah, it's the one
Okay.
that tells muscles to relax.
Okay.
Okay,
So,
you want to try this?
yeah, let's
Okay,
go,
so I want you to
ahead.
just turn just a little bit this way. Okay. So you said before you were tender right about here.
Yeah, right. Oh, yeah, right there.
That's sore. Okay, let me tell you. Is it still tender?
No, but what'd you do? You didn't do anything, did you?
I'm poking harder than I did before.
I know. It's gone.
It's gone. Okay.
Amazing. I'm serious.
Yeah. No, this is incredible stuff.
Okay, find another
Okay,
spot.
find another spot. Okay. Let's see over
Right
here.
there. Right there.
Okay, just a second. Is it better now?
Yeah. Okay, so I'm assuming these results are temporary for now, correct?
Well, if you repeat it a few times, it stays more permanent. But there's some places. I mean, the first place, a lot of people are tender there, so it was a bit of a no-brainer for me to find it. But yeah.
And it's just a process of finding that and then doing some kind of manual therapy.
Okay, so this muscle here, this is called the infraspinatus. It's over your scapula, your wing bone or chicken bone. That's tender there. That's tender right there.
It's a common.
Is that better now?
Yep.
It's gone.
Definitely.
Yeah.
So that's a common place for people to be sore, probably, I'm guessing.
Well, yes and no. So for this particular one here, the infraspinatus, again, it's over your scapula or your wing bone, if you will. This particular muscle is sore for people. There's 2 major groups: people with lung problems, so people with like smokers or asthmatics or that kind of stuff, COPD. They're very commonly tender here. But the other group of people who are tender here are people with anxiety, people who are stressed, uptight, or whatever. And so we have this treatment. We actually came up with this. It's a mixture of a few different therapies, and but this muscle here, the infraspinatus. There's a Dr. Philippot down. I think it wasn't Georgia, but it was one of those places down there, right there too. Is that better?
Yeah, it is. It really is.
But what he did was he discovered that all of his asthmatics were sore in this muscle here. So what he did was he injected the muscle with lidocaine, and suddenly their asthma got better. So he would do, people come back every couple 3 weeks or whatever, get an injection in here with lidocaine, and after about 4 or 5 times, they're off all their asthma medicines. I mean, it's stunning stuff.
That's dramatic.
And so we came up with what we call our breathing protocol, where we do that. We turn off this pain here with injections, and then also on the front of the chest. So like if you're tender, are you tender right there? Yeah. Okay. Is it better now?
Yeah. So okay. So explain to our listeners.
It's gone. It's gone.
Okay. So you touch something over here. So is there a nerve that goes over there? Explain.
Okay. So I don't know that.
Explain what you're doing.
Actually, I can't necessarily explain it, but the concept is, you find a place that's tender. So you're right there.
Right there.
Okay. Is it better now?
Yes.
Okay. And so what you do is you find a place that's tender, and then you find another place that you touch the other place, and it turns the tender point off. Now, with our pain elimination protocol, we do what Dr. Philippot did. We numb up this shoulder blade thing with the numbing medicine, and then we find, and this is where we kind of pioneered this. You find all the tender areas on the front of the chest. We turn those off manually, like I just turned those couple off, and you're like, "Whoa, what happened?" And then what we do is we call it tickle therapy. We take some lidocaine in a syringe with a needle and not poke through the skin, but lightly touch the outside of the skin with the lidocaine over the whole chest, front and back. And then people usually, almost always, they'll say afterwards, "Wow, I haven't breathed this good in years." Seriously, years. And that's number one. That's what they do. So, you're asthmatic. So if I'm working in the ER and a patient comes with an asthma attack, we'll give them the nebulizer and stuff. They're 20, 30% better. We do this and they're 95% better.